Our practice, DeKalb Orthopedics and Sports Medicine, has two locations. One is here in Decatur, and then we also have a location in Lithonia at Stonecrest. We have several providers. We have myself, Dr. Christopher Harasti. There's also Dr. Augustine Kandua, Dr. Paul Richin, Dr. Robert Bachner, Dr. Saf Zaman, and we have two PAs. We have Elizabeth Berlin and Brian Leland.
We will do anything from broken bones to joint replacements, basically anything orthopedic.
Our office is a one-stop shop, if you will, where patients can get x-rays here, they can have injections on site, and even some physical therapy.
You deal with infants on up to the elderly. You can deal with entire families, and that's a lot of fun and very rewarding.
I actually take care of patients with lumbar spine problems, foot problems, hand problems, but my primary focus has been shoulders and hips and knees.
Our staff is definitely a team, and we act that way. We treat each other with respect. We see eye to eye on a lot of topics and issues, and that allows us to function as a team almost seamlessly.
The staff here is just great. They're really lively, and they're really good about reaching out to patients if we need something.
I think we have a lot of camaraderie in this office, and the staff feels very comfortable to be themselves, which I think carries over into taking care of patients. We have happy staff, and I think that means happy patients.
So here it's like a family, and it's always been like a family.
We stand apart from other orthopedic practices in Atlanta with the fact that we spend time with our patients. We tend to consider non-operative management first when it's appropriate.
We have several modalities for non-operative treatment. These include viscosupplementation, otherwise known as gel shots, cortisone shots, bracing, and physical therapy.
When DeKalb took over my practice about 4 years ago, that left me to see my patients and spend more time with them without worrying about things.
We have a huge network of other physicians that are kind of all intertwined, and it's like a close-knit community, which is really beneficial to the patients and us as providers.
I love coming to work each day. For me, it's really not even a job. I look forward to it. I mean, I think that medicine in general should be a calling for people to come in every day and make a difference.
It's great to see different pathology, different patients, different thought processes, I just love what I do.
What motivates me to get up and come to work and help others is the smiles that I see on patients' faces, the glory I see in them and their ability to ambulate and walk when before they actually literally could not. I think that's priceless.